learning pointer கொடுக்க முடியும்.
So shall I start, sir?
Yeah.
So good evening, doctor and all the participants. I Shuman on behalf of Shield Healthcare, welcoming you all in today's webinar. And the topic of today's webinar is respiratory immunity, the newer insight. And our guest speaker is Professor Dr. N. Sankaran, sir. Before moving into the webinar, let's have a look on our Shield Connect page. This is our Shield Connect page. Here you can find different blogs written by many eminent doctors across India. And these are the past webinars already we have conducted in our platform in Shield Connect. And this is the most important blog that is coronavirus awareness blog, that is COVID-19 awareness blog. Here you can find different blogs related to the coronavirus and the immunity as well. And the most important thing is our key opinion leaders. So almost 250 to 300 doctors are currently supporting us in this knowledge sharing platform. Now it's time to start the webinar, and it's my honor to introduce Sir. Sir is a senior consultant physician and specialist in respiratory medicine, practicing at Tirunelveli, Tamil Nadu. Sir had a brief stint in Indian Navy and Jipmara Puducherry also, and worked as a professor of thoracic medicine in Tamil Nadu Medical Service. And Sir has presented many papers in bronchoscopy, allergy, and immunology national conferences as well. So with this short introduction, I request Sir to please take over the session. And meanwhile, I request all the participants for their active participation. And please post your queries on the QA dashboard of the Shield Connect page. So once the program will be over, we shall have a short discussion on this topic with Sir. So thank you, Sir, and over to you, sir.
Yeah, that's right. See, the particular topic of discussion today is respiratory immunity. Apparently looks very simple, but it is intrinsically something complicated to some extent. See that whenever doing my postgraduate studies, the dissertation was on allergy and immunology, where we were all doing studies on atopic, the antibody IgE. And that itself is a laborious process it was. And you see, the person to person, the intrinsic phenomena varies, allergic phenomena varies. Same is true with the immunological status in all individuals. So something intrinsically designed, and therefore one is not complete about everything, but at the same time one has to know what is available as on date, so that we leave no stone unturned to see that we maintain our immunity perfect to an extent possible in order to combat the offending forces. Now researchers are on this topic, especially in the current pandemic scenario. However, areas where people are not very definite about, for no fault of anybody, with respect to the offer of the immunity with medications and vaccination, so on. However, it is necessary that we keep ourselves abreast of all the happenings around, so that we'll be able to be part of the whole program happening around the world, and so that we will have a fairly good life to be able to be what you are meant to be, not to be otherwise. So we just go on to the first slide. So the immunity, if the dictionary definition would be to get exempted. Nobody is immune to many things in life. So is true with immune to infections of different kinds. So immunus means that is spared, is not spared. So it means a freedom from disease, resistance offered by the host against the microorganisms or foreign substances of any kind. And again, as I said, individually designed, so that limitations are there, so that one should be able to know the distinct character of that. Now, the broadly speaking, there are two types. One is innate immunity, which is inborn. A person is born with a disposition, character, and same is true with any kind of a scientific background. It's true with the immunity also. The inborn immunity, which is naturally defined which you get inherit and to a larger extent. And that is called inborn or innate natural immunity. The other one is acquired, adaptive. That is as a result of infection, which may happen silently, sometimes overt, sometimes occult. And that silently, as we see today, many people may have increased antibodies against a particular virus. That is getting adaptive or acquired immunity, even happening after vaccination. So acquired adaptive immunity is something acquired during a part of life due to exposure to the antigen of any kind. Next slide. So here, the innate immunity or the natural immunity, inborn immunity, the barriers are there, given by nature. Offending forces are given by nature, barriers are given by nature. That is looks a little paradox, you see. The molecule microbes of any kind, we try to enter the system, for example, epithelial barriers with a protective, they enter. And the phagocytes are waiting for the opportunity to engulf them. They engulf them in the natural, in the innate immunity by the complement participation and the natural killer cells. They participate in the short-lived one, and prior exposure is not required. This is otherwise innate, natural, or inborn immunity. The one which we see is happening after infection, again, overt or occult, is acquired immunity or adaptive immunity, which we are very much interested in, because it's something innate immunity, something not mutable. This probably is within our hand, in the hand, so that we'll be able to get the maximum benefit out of the possible sources of getting adaptive immunity. Here we got the B lymphocytes and T lymphocytes. The B lymphocytes and T lymphocytes is both are thymus-dependent lymphocytes and both are produced in the bone marrow. The B lymphocytes are getting to transform themselves into plasma cells to produce antibodies of different kinds. The two which are important is IgM and IgG. These antibodies are there produced by the plasma cells from the B lymphocytes. This is called humoral immunity, which is happening mostly in bacterial infections. In some parasitic viral infections and tuberculosis and similar leprosy and so on, with the participation of cell-mediated immunity, which is called CMI. There, the T lymphocytes are there. It's called thymus-dependent lymphocytes, which are again produced in the bone marrow. And these produce a different cytokine like lymphokines. Example is one migration inhibitory factor, MIF. And this will be causing engulfing of the bacteria and destroying them. So that adaptive immunity can be humoral and cell-mediated through B lymphocytes and T lymphocytes respectively. Next one. Next slide, please. So that the role of immune system as a whole, the defensive force, is against microbes of any kind. It's happening. And against the tumor cells, they kill the tumor cells. Maintaining the eco balance with homeostasis, the balance, the balance which is necessary, striking the balance between the defending forces and offending forces by these mechanisms already mentioned. They destroy abnormal dead cells. That is, example, dead RBCs, WBCs, and an antibody complex. They are all being engulfed. That's maintaining the bioequivalence. So next slide. This is the role of immune system. Now, as we said, the innate immunity, the components are, that is the natural immunity components is anatomical barriers. For example, skin and mucosa, the hair in the nasal nostrils, hair in the skin, etc. The mucosa again is epithelial cells of giving protection. And then we have got a body temperature, which is trying to give natural protection. The neutrophils, macrophages, and monocytes, neutrophils, especially in case of bacteria of some kind, and macrophages, again, monocytes, again, for the cell-mediated immunity, they are able to engulf, and they are called phagocytes. Then we got the natural killer cells, many of the other classes of lymphocytes, mast cells, dendrites, complement pathways, and the fever and inflammatory response. In fact, inflammation is really a protective phenomenon, the backholder. But overwhelming inflammation becomes destructive. They destroy the individual's the bearing capacity. That is why we are forced to give some anti-inflammatory drugs, though we know that inflammation is a protective phenomenon. Although that does not overdrug a person with anti-inflammatory drugs because natural protective phenomena will be offended. The natural resistant flora, for example, we got in the intestine, the lactobacillus, many of the staphylococcus in the skin are all there, which will be giving resident flora, which are able to give some protection. The cytokines, the tumor necrosis factor, and various interleukins of cytokines like the 1, 6, 8, 12, and 16, and so on, the gamma interferon, are all there in addition to acute phase reactants, which are the components of the innate immunity and natural immunity bestowed upon by nature, once again, different in different individuals as decided. The acquired immunity, as we said, is once again due to infection or vaccination. And this is by the two cells already mentioned, the T lymphocytes and B lymphocytes, the T for the cell-mediated immunity, and against the bacteria and some against viruses and bacteria, and for example, tuberculosis, and the B cells once again for the humoral immunity. The immunity inborn resistance, individual, and due to something transmitted from the parent, due to genetic and conducive. And this vaccine, it features reacts in minutes, very fast. There is no memory. It is not specific. The components of the immunity, once again, skin mucosa, body temperature, these are the mentioned. Next one. The innate immunity is inborn resistance against infections and present at birth due to genetic component. And the features are accident in minutes. And this is not unbiased. There is no memory for that. It's a short-lived one. And so that is again given for initially, in order to give protection against infections of different kinds happening initially. Next one. The factors influencing the innate immunity are the young people, children, babies, very old people after 60, 70, and so on. There's a decline in the natural defense mechanism as one ages. Similarly, children, before they grow up, they have low amount of the antibodies as well as the macrophages and lymphocytes. They have low. And hormones like endocrine factors, for example, thyroid hormone, hypothyroid people have low immunity. Diabetes, again, the immunity is low. And then we got the thyroid, the adrenal aspects of adrenal, for example, steroids, again, lower the body's immunities towards the adrenal dysfunction. They all decide the status of the immunity in the individual. Nutrition component, we want antioxidants, we want proteins there in order to build up the immunity in general. So the age, hormone, nutrition are factors which influence the innate immunity one is born with. Next one. Now, this is something important because mechanisms are apparative here. Receptor interaction. See, receptors are there in the bacteria, which are being attached by the defense forces, and ultimately they are killed. The one surface molecule example will be peptidoglycan. So both the receptors in the bacteria and that in the defending forces join together for the discharge of the microorganisms. Next one. The pattern recognition receptors. The molecules present on the surface whole cells recognize the PS. And there are the conserved regions encoded germ genes. The toll-like receptors lie in there. For example, we've got plenty of receptors. The TNR, the 13 types of receptors, they're not very important. Next one. The phagocytosis is engulfing, actually happening by the neutrophils, the macrophages, and monocytes. They are the components of innate immunity. Rapidly recruited infection site, the phagocytosis involves 3 sequential steps. Initially, engulfment of the microbes, subsequent hosting in phagocyme. The lysozymes are produced, which join hands with the phagosome and in killing the bacteria, the microorganisms. Next one. The inflammatory response, as he said, once again, is a protective phenomena to destroy the offending process at the same time, sometimes overwhelming, causing local destruction. The vasodilatation happens so that there will be recruitment of phagocytes, neutrophils, and there will also be production of the exudates there. All of them join together in order to face the microorganisms and then engulf them and destroy them. Next one, please. The cytokines, interleukins of different types are there. And in response to microbial antigens, the macrophage other cells secrete several cytokines that mediate many of the cellular interaction of innate immunity, like tumor necrosis factor, interferon gamma, the transforming growth factor, and the interleukins 6, 8, 10, and 16. In asthma allergy, it is 5, 9, 11 that way. This is once again for the against the microorganisms. Next one. We find acute phase reaction proteins are synthesized in the liver and from other areas also. And there are various antimicrobial anti-inflammatory activities, example, complement factors, which is given by the acute phase reaction proteins. Next one. The positive APR, for example, serum amyloid. The alpha-1 antitrypsin example is, for example, there are people who have low amount of alpha-1 antitrypsin, they tend to develop emphysema as a part of COPD. And C-reactive protein, which is being measured for the inflammatory, as an inflammatory marker of any kind, not specific at all, which is being measured these days to know the level of inflammation happening in the system. Varies from person to person, and the level of which decides the severity of the problem, the inflammatory phenomena of different kinds. Next one. The proteins whose levels are decreased in acute inflammation, creating negative feedback. Whenever the protein produced and delivered reduces, there is negative feedback so that it will be able to produce the one which will be giving positive reaction. For example, albumin, transferrin, antithrombin, they are the examples of negative APRs. Next one. The C-reactive protein is the one talk of the day, and everybody starts asking for the C-reactive protein of due to infection of different kinds, inflammation of different kinds. If this belongs to beta globulin family, it is called C-reactive because it precipitates with C, the carbohydrate antigen of the pneumococcal, which is not specific to pneumococcal at the same time. It is not specific, can be raised in any inflammatory conditions. For example, whenever there's a myocardial problem, ischemic problem, we go in for the specific, that highly specific CRP. And otherwise, it is a general thing, but it tells you the level of the seriousness behind the inflammatory phenomena, the degree of the inflammatory phenomena operating behind. Next one. For example, normal is less than 0.2 milligram ml. And the level for it is less than 1, it is insignificant, is common, cold, pregnancy, exercise, etc. The moderate increase 1 to 10. I mean, bronchitis, cystitis, pancreatitis, myocardial infarction, once again, may go in for highly specific CRP. The marketing is more than 10 because of acute bacterial infection and systemic vasculitis like polyarteritis, neurosa, SLE, and so on. In other words, it doesn't give you a big idea about the cause of the problem, inflammation, but tells you the level or degree of the problem. It's a marker of the degree of the problem, inflammatory problem. Next one. Yeah. Now coming to the properties of acquired immunity, which we're bothered about, because there's something which can be done in your, it's something in your hand. The mediators at cell and B, cell T cells, as I told you, the one cell mediated immunity through the lymphokines, and B cells produce plasmas and the gamma, and they produce the IgG, IgM. IgM is early one, IgG, which was operated later on. And the complement pathways, the cytokine 2, 4, and 5 again are operative mediators. Its response occurs later on, not immediately, unlike in case of human immunity. It requires prior microbial exposure. It may be due to an occult or overt, natural, silent one, again, to vaccination. This can give you acquired immunity. That's why we recommend vaccination. This is in order to acquire immunity so that the fundamental infection and complication will be averted to a larger extent. Next one. Next slide, please. Yeah. Active immunity and passive one. The passive one and active one, once again, as we said, it is because of initially it is not there, later on to the infection naturally happening. Vaccination, which being the life one, artificial one. There's a, whereas this one, the passive immunity is because the immunoglobulins are given, the IgG. And mother to fetus IgG transfer. Ready-made available plasma therapy given for the current pandemic, for example, gives you the ready-made antibody transfer for tackle initially the people with less amount of immunity. There's no memory, no lag period, whether the acquired immunity, active immunity has a lag period and memory present. Booster dose is useful, whereas in case of passive immunity, no less subsequent dose is less effective. Negative phase may occur, no negative phase. So we are more interested in getting active immunity through vaccination and silent infection, and so that complication will be avoided. Next one. Yeah, initially we find that IgM, as soon as the infection is there, primary exposure, IgM increases to initial recruiters, which is once again from the plasma cell. As time passes by, the Ig comes to the picture to give a helping hand to IgM, so that it takes over full charge situation to offer humoral immunity to second exposure. Next one. The local immune status. See, for example, the nature, the divinity has given us areas, different areas where protection is given. For example, epithelial cells, the skin, we have got a IgA. It's immunoglobulin IgA, is present in the surface and the epithelial lining in the respiratory genitourinary mucosa. We're all trying to give protection initially so that entry could be prevented to a large extent, provided the dose is less. This could be prevented. This is a local immunity. Next one. When coming to the pulmonary system, we got plenty of components are operative here, and large particles are being deposited. The tonsils that emphasize primary defenses. That's why these days the ENT people others think twice before removing the tonsil for tonsillitis, unless really warranted, to prevent rheumatic fever, rheumatic arthritis, and nephritis. Otherwise, we shave the tonsils. Nasopharynx, once again, we've got a protective fossa deposited, and the hairs in the nasal, plus the ciliary component in the lungs. They have come to the picture to remove them. In the lungs, we've got a cilia, mucus production, and the mucus forms a layer of the cilia like a blanket, which is called mucus blanket. When the foreign substances of different kinds, animate, inanimate, microbial, otherwise, they get deposited, like the passengers get into the vehicle, the bus start running once it's filled up, the mucus blanket starts moving upwards. This is called mucociliary escalator mechanism operative, natural defense forces coming to upper airways to be expelled to be by natural coughing as well as spitting. And then we have got various anatomic components in the mucus layer, collecting and so on. They all bind to the bacterial cell walls, allowing the uptake by the immune cells. So natural defense forces operating in the pulmonary system so to a large extent. So one has to be careful when he preserves that. For example, we say no tobacco smoking, and pollution, etc., because the natural and different force will be affected. The mucosal respiratory mechanism in the pulmonary system will be affected by atmospheric pollution, tobacco smoking, and so on. So we have to preserve that to the extent possible the natural different forces offered by nature. Next one. Now, once again, the repetition of the same thing. We are in the practical. The figure is given. Next one, please. Couple of slides has to rush through that because the repetition, same thing. The structure of the mucosa there once again. Next one. This is why in the structure, the alveolar component, the alveolar macrophage, AVM, are there by chance that the filter is not happening, the alveolar macrophage waiting there, and they will be able to engulf and be able to send out. And that's why alveolar component has to be kept tight. The failing which patient may go in for emphysema, the destruction, dilatation, alveolar, and respiratory bronchioles. And next one, please.
Next beta.
That's okay. Next one. That could be passed off. Yeah. That again, already I'll discuss. Next one. Yeah, next one, please. Now, passive immunity, active immunity. We talked about passive immunity. Passive immunity is people deficient immune system, immunocompromised individual whose hepatitis is not effective, and the post-exposure prophylaxis immediately for immediate the immunity development. We may think of giving them because step faster, no lag phase at all. There is no immunological memory at all. The booster dose will not be effective, unlike in the case of active immunity. Next one.
And next, stay there.
Now we talk about the IgM, IgG. People have started measuring IgG, IgM. Previous one, please. Previous one. Previous one.
No, previous.
Previous.
No, previous.
Previous. Yeah, that's right. Right. Wait, just wait. Now the IgM is said IgG people start measuring after vaccination. After infection, about 2 to 3 weeks later, to know the level of the immunity that has come up after natural infection and vaccination. And so that you know, to a large extent, the individual protected for a fairly long period remains to be seen. So initial is the IgM, early antibodies, and afterwards, the late antibodies, IgG, they participate and try to give you the humoral immunity components. Next one. Now I think
in slide number 30. Slide number 30.
Slide number this is
30.
passive immunity.
Slide number 30.
But which one?
Slide number 30. 30.
Slide number 30. 30. Next one. That's right. Now the innate immunity and adaptive immunity. I'll discuss actually. And T cells, we said, we have a T cells, CD8, CD4. Wait, just, no, please, previous one, yet to discuss. Previous one. The previous. Regarding CD8, CD4.
Yes.
Is it no?
The.
CD8, CD4 then? Prior to that, next one. Next one. Next one, please. Next one. This one. Wait, just wait. The CD8 and CD4. The CD4 the cells are responsible for the protection of B cells, plasma cells, and humoral immunity. CD4. The CD8 is once again for the cell-mediated, as in the case of SARS, the coronavirus infected cells by killing the virus, CD8, and CD4 for the formation of humoral immunity through B cells. And we talked about IgG, and IgM. Again, already the early onset IgM, late on IgG. Yes. Just wait. Now, what do we know about the immune response in the case of the SARS coronavirus 2. Most patients recover from COVID after having antibodies detectable in their blood. And most COVID-19 patients develop antibodies in 10 to 15 days. We measure the serum antibody level. This is around the time when patients try to recover, slowly recover from the fever, cough, etc., and dyspnea, provided, depending on the degree of the problem. The neutralizing antibodies appear to be higher in patients with severe disease, and patients who are mild asymptomatic COVID-19 have low levels of neutralizing antibodies. These patients possible innate immune response and T response to clear the virus. Most antibody tests cannot differentiate between neutralizing and non-neutralizing antibodies. Rapid antibody detectors do not measure the quantity of antibodies. More complex tests, ELISA tests are all available. So we try to measure the antibody level about 2 weeks after infection and vaccination also to know whether the individual has acquired the immunity against the virus to the extent possible. Next one. Next one, please. Yeah. Now, can antibodies against SARS-CoV protect us from being infected? Now, everything is sort of to some extent in darkness as to what thing, but at the same time, we're optimistic that things will be in favor of the individual per se, but at the same time, not 100% sure about these things. Probably as years, months go by, years go by, we'll have a clear picture of what is happening inside. Now, generally, a person will recover from the viral infection protected against reinfection or severe disease. And however, these are antibodies to adequate quantity, neutralizing antibodies in particular. The changes in the virus sequence can make prior immunity less effective. Example, influenza. The protection from infection with common cold is short-term. For other coronavirus like severe acute respiratory syndrome, SARS, and the middle respiratory syndrome, antibodies have been detected a few years later, not immediately. So for emerging coronavirus, we do not yet have enough data to confirm that antibodies protect. They do level. What antibody will be required? How long will it last? Once again, research tells us to a large extent for about 6 months after vaccination and infection, but probably longer than that, and maybe from individual to individual. However, the sudden infection in the society is coming up. Serological studies done in India and worldwide.
I think there is network issue. Maji, doctor disconnected.
இந்தாங்க. ம். இதை வச்சு பேசுங்க, அது கண் தெரியாது.
Now, can I resume?
Yeah, sir. Yes, sir.
Sorry for the technical snack.
Yeah, sir. You can start, sir.
Something happening beyond. I decided.
Yeah, sir. Sir, we can't hear you properly. Maybe there is some network problem.
Antibody measure.
இங்க பக்கத்துல வச்சுக்கணும். இதை வச்சுன்னு பேசுங்க, அங்க வச்சு. Here. You can.
That's right. Now, a person who recovers from viral infection is protected against a new infection or against rare disease. However, this requires antibodies to be of adequate quality. Adequate quantity. Neutralizing antibodies. So, quality and quantity of the antibodies produced is important to decide to avert future infections, future severe infections in particular. Changes in virus sequence can make prior immunity less effective. Protection from reinfection with common cold possible. For other coronas, severe acute respiratory syndrome and Middle East respiratory syndrome, antibodies have been detected a few years later. So for the emerging coronavirus, we do not yet have enough data to confirm that the antibodies protect. What the antibody levels are required and how long it lasts. However, research papers are coming out slowly, giving us optimism that the antibodies have level of something great to do to avert future infection. Now, next one. Now, what does a positive antibody test mean? It tells us the person was infected in the past. If IgM, IgG person recent infection. IgM negative, Ig positive means it happened in the past, long back, several weeks back. And it doesn't tell us if a person is recovered. It doesn't prevent present infection also. So present infection may be there and positivity may be there, maybe lingering on. If antibodies as a neutralizing, unless specific assay is used. What antibody levels are, unless specific, it doesn't tell us. Next one. What does negative test tell us? It could mean the person has not been infected or recently infected for a short period, yet the antibody level to come up. The person was infected, but clear the virus without mounting antibody response. That is innate and T-cell response, clear the virus. Or the person was infected, mounted an antibody response, but the antibody levels are below the level of detection test. All these are all possible. So negative doesn't mean there is no immunity. Next one. Next one. Now we are entering the very important aspect of the preventive aspect, which is in our control, something which we can concentrate on so that in addition to vaccination, so that we could be definitely get sufficient amount of immunity to prevent infection, serious infection in particular. One should have adequate sleep. That gives, that's why getting adequate rest may strengthen the natural immunity. And as you sleep more and seek to allow immune system to better, then eat more plant foods. That is the fruits, vegetables, nuts, which contain 3-omega, and antioxidants may be required, AC, or they may give you upper hand against harmful pathogens. And then inflammation could be combated to a larger extent. The free radicals could be removed by adequate plant foods. Furthermore, fruits and vegetables are rich in nutrients like vitamin C, which may reduce duration of common cold. Next one. Eat more healthy fats. Healthy fats olive oil, salmon. Olive oil is again anti-inflammatory. More fermented food and take probiotic. Probiotic is essential because they will be able to give you sufficient strength and immunity. The gut health, well, of course, lactobacillus is there. Immunity is deeply interconnected. It doesn't give immunity to the local site, again, disseminated. That's why I was talking about it to my medical colleagues about the role of probiotics and the immunological status. It's supposed to bolster the immune system by helping it identify and target harmful pathogens. That's the advantage of taking the probiotics supplement. Next one. Exercise is essential. Moderate exercise can reduce inflammation and help the immune system regenerate regularly. After prolonged intense exercise can suppress the immune system. Moderate exercise is essential. It can reduce inflammation, promote healthy turnover of immune cells, like walking, jogging. Take sufficient amount of water, hydration, of liquid of any kind to prevent the dehydration. One should drink enough of fluid to make the urine pale. Water is recommended because it's free of calories, additive, and sugar. Next one. Stress levels. That is more prevalent because of the current scenario. Relieving stress of any kind, anxiety on any issue for the matter, will affect the system. So keep oneself, because the hormones which are essential to be the healthy hormone, the endorphins, feel good hormones will be produced. The stress level is reduced. Long-term stress production inflammation promotes inflammation as well as imbalance the immune system. So it will affect the promote inflammation at the same time. Immune system function will be affected by stress levels. Activities may help to manage stress levels like meditation, exercise, yoga exercise, and mindfulness practices. You may benefit from seeing a licensed counselor, therapist, whether virtually or in person. Lowering your stress level through meditation, yoga exercise, other practices to keep the immune system level function properly and give you sufficient boost. Next one. Vitamin D, well, it's you sunlight, gives you the fatty acids behind the skin is converted into vitamin D, the healthy vitamin D. And the essential for immune function, not only for the bone health, but also for general immunity. Zinc supplementation is essential because it gives you boost your immune system. Zinc is essential for immune system. Needed for immune development and communication plays an important role in the inflammatory process. Zinc supplements protect against respiratory tract infections, in particular against viruses causing common cold. Next one. Vitamin C supplements available plenty in fruits. They promote immunity status and respiratory infections, including common cold by rhinovirus and other type of viruses. Rhinovirus is a type of virus that produce a common cold, acute rhinitis. Next one. Next one. Now, curcumin has come to the picture. It's very essential. It has got a lot of benefits, and it doesn't spare any efforts to boost the body's immunity at different levels. So the one has to always concentrate on this aspect to get more immunity, especially in COVID-19. Next one. It has got antiviral, antifungal, anti-inflammatory action, gives a protection mechanism. It is immunomodulatory, and it has an antioxidant property also. Curcumin, the multifaceted the pharmacodynamic profile is offered by curcumin. Next one. Next one, please. It's all only theoretical interest. Next one. That is a probiotic we'll talk about. They are very essential against very type of infections, virus infection in particular. The epithelial barriers are strengthened, and the lymphocytes, the cytokines increase, we give protection. The tumor necrosis factor gamma interferon again decreases, reducing inflammation. So that the probiotics, like the lactobacillus group, are essential for the systemic immunological boost. Next one. Next one, please. Next one. Next one. The herd immunity is a silent infection. Recently, we read in the papers that the serosurveillance has been done. They find that many areas there is increased level of antibodies against the corona, and that gives herd immunity, vaccination too. So community-wise, when people get infected, silently, subclinically, herd immunity is strengthened. The elements that contribute to create a strong herd immunity are occurrence of clinical, subclinical cases, occult, ongoing immunization program, effective. India does it very well, coverage is excellent, and we are very happy about it. The herd structure, population goal. The type of pathogen, herd immunity may be strong in a community against all pathogens, though vary from place to place. And in general, herd immunity is essential to prevent future surge of the infection of any kind, present corona but in particular. Next one. So thank you. And then before I conclude, we'd like to say that we have to concentrate optimistically, with cautious optimism, on factors which within our grip in order to boost our herd immunity and the individual immunity, so that we will be leaving no stone unturned to prevent future catastrophic eventualities as are happening some time back. And we are confident with the natural defense forces operative, with the divine backing, we will be able to have a healthy life ahead and enjoy the benefits of human living, making the pathway to be able to be what was supposed to be. I'm very happy God will nature will bestow upon everybody health and happiness in the days to come, years to come, ever. Thank you very much for patient listening. Thank you very much. Thank you. Bye-bye.
Thank you, sir. Thank you very much for this nice and informative presentation. And meanwhile, I received few questions, sir. So if you allow me, then we can discuss on that questionnaires.
Questions.
Am I audible, sir?
Yeah, I'm just hearing, listening.
Yeah, sir.
Anybody is as good as the other person with respect to the current scenario. However, somebody may be a little higher than the other. Please, any questions?
Sir, the first question is, sir, what is your suggestion to boost the overall immunity in this COVID era time?
To boost the overall immunity, as you said, we talked about curcumin and various type of healthy food containing vitamins and minerals, proteins, antioxidant therapy, exercise and yoga meditations, stress-free life, are all adding. Plus the vaccination to be taken and prevent mask usage. The mask has to be used ever because we do not know when and where things will happen contrary. And then, of course, maintaining the social distancing and then preventing overcrowding, etc. should be done. As far as the prevention aspect is concerned, vaccination plus the nutrient factors should be given utmost importance so that we can be doubly sure the possibility will be the least. Yeah.
Okay, sir. Thank you. And sir, another question is, we have come across some comments from the physicians also that it is not possible to do the immunity boosting within 3 or 4 months or so. It is a lifelong process. So what is the suggestion on this aspect, sir?
To be true. Because you see, we do not know how long this particular virus or any other bacteria virus has been in vogue. But only thing is when the virulence increases and the quantum increases, we are affected. They may be happening silently for long. Because in fact, one of the medical manager who came from Chennai to me, I could see him very much reduced in voice. I was asking what happened. He said in Mumbai about 2-3 years back, where he was in the airport, he contracted a virus pneumonia, which was then just called viral pneumonia. And then he was bedridden, he was put on ventilator, ECMO therapy and so on, and recovered. So this is all happening silently. It's a lifelong process only as a healthy system. And then for healthy long life, one has to adopt these measures lifetime, because it's not a question of, it's not an epidemic issue. So it is a silent endemic issue also. But only sporadically it comes up fast. The surge is there, people are concentrating on that, not otherwise. But as you said, as the doctors feel, I also feel that one has to be always protective oneself, and all measures be taken so that lifetime the prevention is needed to prevent the silent surge at any time during life. True, that is right.
Okay, sir. Sir, another question is very relevant to this topic, that in terms of SARS-CoV-2, sir, what is the difference between the antibody response between asymptomatic and symptomatic patient?
Antibody response?
Yes, sir. In case of asymptomatic and in case of symptomatic patient, what is the difference between the? Yes.
That's
yes,
right.
Sir.
Yeah, when the symptomatic people, probably the viral load and the virulence will be less. So it may not be, for example, Delta, they say this is a very virulent one. There it may be more antibody response, and the other people less. So antibody response in the mild cases may not be much, especially the IgM level. In the people who had a high level of antibodies, they must have had moderate to severe infection. And with respect to protection, nothing can be sort of intruded upon. But antibody level will be more in people with severe infection and less people with a mild infection. But protection load is always there. Yes.
Okay, sir. And sir, I have another question. That, sir, generation of B cell memory contributes to long-term immunity, as we all know. But why in case of SARS-CoV-2, there is a memory response is too low, or so people are affecting 2-3 times, or after vaccination also? So what is the reason behind that?
That is true. See, the T cells which are giving because I had a lot of work in this particular T cell phenomena when I was in Bangalore in the National Tuberculosis Institute, because they were all doing a lot of work on the T lymphocytes, CD8 lymphocytes level in tuberculosis people who are after BCG vaccination, after infection, so on. The memory is, it has got a memory, and then as time passes by, the T cell protection may decline also to some extent with individual variation. But however, when the initial infection, the T cells are more, the CD8 cells are more because of infection. They will be long-lasting compared to those with the mild infection, less amount of the T lymphocyte, the CD lymphocytes in the beginning. But compared to the humoral immunity, definitely the immunity is lasting longer than the humoral immunity. But how long remains to be seen. Individual variations are there depending on the inbuilt phenomena operating in the system, the genetic factor in particular. Yes.
So thank you very much, sir. I could not find any other question. So with your prior permission, I can start one video of just 2 minutes. Sir?
Yes.
Yes, sir. Just with your permission only, I just share one video of 2 minutes, sir.
Yes.
Okay, sir. Thank you very much, sir.
Please tell again. Not understood properly.
Ma'am, just with your permission, I will share just 1 minute, 2 minute video. One video I want to play.
One video?
One video I want to play. With your permission.
Yes, you can
only.
play. You can
Yes.
play. Sure. We'll see.
Okay,
Okay,
ma'am.
thank you.
Okay, thank you, ma'am.
Definitely encouraging. Definitely.
இதுலதான் வரும் வீடியோ.
Judge.
இதுல வரும் வீடியோ போடுறேன்.
Shield Healthcare, transforming health with innovation and technology, is the winner of the prestigious Indian Health and Wellness Award. Likes to thank you for helping us achieve through your valuable partnership. Health issues like recurrent respiratory infections can cause complex physiological and biochemical changes leading to ambulatory condition. Therefore, we need a specific immune booster to strengthen the respiratory immunity. So, introducing Rudimin Mu tablets and Rudimin Mu syrup to strengthen the respiratory immunity. Rudimin Mu tablets and syrup are a specific combination of 4 bioactive ingredients along with immunovitamins and minerals. The bioactive ingredients are tinocoridin, curcuminoids, Asimenin,
Yes.
Osimum sanctum. Rudimin Mu is also enriched with immunovitamins like vitamin A, vitamin C, vitamin D3, and minerals like zinc and selenium. As per ESPN guidelines May 20, daily allowance of vitamins, minerals, and trace elements maximizes nutritional defense for patients susceptible to frequent respiratory infections. Therefore, please prescribe Rudimin Mu tablets and syrup in recurrent respiratory infections. Only Rudimin Mu strengthens the respiratory immunity. Dose of Rudimin Mu tablet is 1 tablet BID. Dose of Rudimin Mu syrup is 5 ml BID. Doctor, Rudimin Mu shields immunity. Thank you.
Excellent.
So thank you very much,
In
sir,
fact, I tell you,
for your valuable
no day
time.
passes off.
Pardon, sir?
No day passes off without prescription Rudimin Mu from my table.
Oh, yes, sir. Thank you very much, sir. And
No
thank
exaggeration.
Thank you very much, sir, for your valuable time in our platform. And in future also, we will look forward from some valuable session from you, sir.
Excellent. Thank you very much.
So thank
For
you
the
very much, sir.
opportunity. But we reciprocate.
Thank you very much, sir, once again for your time. So
Yeah.
with your permission, sir, we can close this session for today. Thank you very much, sir.
My pleasure. My pleasure. My pleasure. Thank you.